So I'd like to introduce our next speaker is Christine Rosche. Christine is a board-certified nutrition specialist and biofeedback therapist with 25 years of experience in the healthcare field. She developed and taught courses at Stanford University Medical Center and Heart Disease Prevention Program and is the author of 2 books. She has maintained a private practice in Palo Alto since 1980 and specializes in functional testing and integrative approaches for digestive issues, including GERD, malabsorption issues, gut permeability, IBS, IBD, Crohn's, constipation, and inflammatory bowel disease. As a licensed heart math trainer, I hope to talk more about that. I'm not sure what that means. Christine is pioneering the integration of heart math, heart rate variability biofeedback training with custom nutrition and gut healing protocols. So please welcome Christine Rosche.
You know, I was reminded, thank you so much for your wonderful presentation. And growing up in Europe, I've always been interested in the root cause of healthcare. And we all know that many of you have seen the Hippocrates, all disease begins in the gut. And for myself, I had worked at Stanford Medical Center for many years. And one of the things that we were doing was interviewing so many patients about different kinds of conditions, what the outcome was, a lot of them different inflammation and GI diseases. And of course, we all know that often what happens in medicine is that we're actually, when we diagnose, we're just looking at one aspect of it, which is what we were doing, which is very useful. It's very important to have that aspect of diagnosis. So I'm just going to show you.
Sorry, I just want to point out, it's very hard for the people to see from the screen, so you might.
Okay. Yeah, this is the functional medicine tree. So basically what it means is that it's a little hard to see, is that each branch of medicine is represented by the branches. And that's very important for diagnosis. And then there's all of these other factors that are underneath in the roots of the tree. And so what I'm going to talk to you about today is the microbiome, which is one of the root causes and is involved in every possible aspect of health and disease. So it's very important to look at, all of the things. These are all of the root causes. So we want to combine the diagnosis of the leaves and branches, where pharmaceutical medicine is so helpful, with the actual aspect of the roots, the nutrients, all of these root causes. So I've been working in different clinics with functional medicine physicians with incredible outcomes using both the best of both worlds, right? From the branches and all the different systems, and then also the root cause. So that's what I'm going to talk to you about today. And I have been getting involved in a lot of studies and research around what actually happens with the gut bacteria. So we're going to go on an interesting journey. I'd like to start by telling you a story. How many of you know about the blue zones? Most of you do. Okay, so the places on the earth where people live, many times into very ripe old age. And this is just an example of a boy named Nico who's born on that Greek Aegean island. And he's born naturally, he's breastfed for several years, as all the children are. And he just eats all of the natural whole foods. And basically when he gets ill, he gets honey. He gets natural antimicrobials. And so because there's no TV, he's very social. He's also engaging with his family and really participating in life. And so what everything has shown, and I know many of you have read these studies, is that there's virtually no dementia or Alzheimer's. There's basically very little cancer in those societies, and half the rate of heart disease. And I'm going to tie that in with the microbiome, because when so many times, here's an example of of what happens. Just imagine Carolyn is born anywhere in the United States, and we have such an increase in the C-sections right now in this country, as you all know. Formula fed, so many times, there's multiple infections when she's a child, getting antibiotics every year. She's eating white flour, white sugar, she's eating a processed diet, and at age 6, she's already very overweight and diabetic. And at age 50, she develops MS and a chronic disease. So what do these, the Carolyn, if you look at Nico and Carolyn, you can see that one of the core aspects of the microbiome foundation is how you're born, whether you're born vaginally and getting all of that rich microbiome at the time of birth from your mother, or whether you are born with C-section is a key factor. So what are your risk factors? So at the end of the presentation, I have a sign-up sheet there if you're interested in finding out more about a test that I do with people about their risk factors for an unstable microbiome or dysbiotic bacteria, were you born C-section, breastfed less than a month, did you have your tonsils out? These are just a few, of the many. I'm just giving you an example of that. And have you had frequent infections, antibiotics every few years? All of that. Are you constipated, depressed, or have you had trauma? So those are some of many in my practice that I found really affected the microbiome. So one of the key things that I found really effective is to test your gut. And doing that comprehensive digestive analysis, stool analysis, can tell you a lot about your microbiome. It's not everything, but it will give you very important clues and information. So what's going on right now that's different? So we all know we have increased toxins, we have air pollution, we have way too many antibiotics, and the diet, all these, there's so many factors, because we do have an epidemic right now of chronic disease, especially autoimmune, as all of you know. And so I have done quite a bit of work in that area with patients with Hashimoto's thyroiditis, with MS, also with Crohn's, other autoimmune, with very good results using a functional medicine approach, which means, as I was saying, addressing the root cause, looking at the lifestyle factors, but also working with a combination of different treatment approaches. So basically, in the last century, we have had an unprecedented amount of industrial farming in this country. So when you go back to the blue zones again, you can see the impact that we've had on us in terms of pesticides, herbicides, GMO. And it turns out that the gut bacteria really change in response to genetically modified food. It does affect, just like antibiotics affect the microbiome, but more importantly, the food we eat affects it quite a bit. And so I'm going to be talking about that. Antibiotics are life-saving. They should absolutely be taken if necessary, but they also lower our immune cells, and they weaken our intestinal barrier. So most people who are now on prescription pharmaceuticals consistently always are dealing with a barrier that is impacted. How many of you know about leaky gut? I'm sure everyone has heard that. Intestinal permeability, the lining of the gut. Antibiotics increase childhood obesity by 50%. So if you're given antibiotics the first 6 months of life, then you're much more likely to have a situation with obesity. And we all know now about the antibiotic-resistant superbugs. And so coincidentally, when I was preparing this presentation, in the Palo Alto newspaper, it said that Honey Smacks from Kellogg was now recalled in 31 states because of salmonella in cereal. And when I saw that, and then the next day, the Palo Alto newspaper weekly reported that melons had been recalled in this area because of salmonella. We know how serious this is because of the livestock and the way the farm animals are treated. You all know that. With the kinds of agents, the pesticides, the insecticides, what we have now is a situation where you can go to any hospital, even with a small cut, and if your microbiome is not strong enough, you can catch a superbug. You've seen them on the magazines, everything. So I've been very concerned about the fact that this, salmonella is now in fruit. It's no longer in just eggs and meat. That it is a sign of the times that we have really done so much to change our ecosystem, which has changed. So the microbiome changes I'm going to talk about is just a symbol of the ecosystem going. We have 100 trillion microorganisms in our body. We have 10 times the number of cells and 150 times as many genes. And so basically our microbiome is a living system in every cell of our body. We think of it in the gut, and that's where the majority of it is, but it's also everywhere. So microbes produce a lot of anti-tumor, anti-inflammatory properties. that our genome cannot produce. That's why it's so critical that we pay attention to this. And it also varies across the mouth, nose, lower intestine, and vagina. There's very different microbial landscape throughout our body. So our flora is our friend. It helps us to digest our food. I work in a clinic where many patients have malabsorption, maldigestion, gut permeability, and they're very malnourished, even if they have a lot of weight on, because they do not have the right bacteria. You must have a healthy microbiome to really get your nutrients that you need. So this is one of our friends, and having, I'm going to be talking about different species, because different species of microbiome, actually bacteria produce neurotransmitters in the brain. So we have an anxiety epidemic right now, and when you inject the mice with a certain type of good bacteria, you actually then have the brain chemistry changing. So it's amazing to see that. So I'm going to show you which bacteria affects what in the brain. But one thing that is known, because we spray glyphosate and Roundup everywhere in our gardens, it's everywhere, it's airborne, it changes and reduces the composition of gut bacteria. So genetically modified food and the glyphosate has had a huge impact in our ability to detoxify, which is what we need the most right now. That's why when I work with people, I always recommend detox several times a year, working with different detoxification, because we're bombarded, right? By the air we breathe, by the water, everywhere, by so many toxins. And glyphosates compromise that ability of the phase 1 and phase 2 pathways. It impairs our function of vitamin D, impairs the neurotransmitter production, and depletes many different nutrients and affects our mood also. So it's important to know that this depression, when I was working at Stanford, we were looking at depression, but now in the functional medicine clinics, it's like the anxiety and depression is almost in every person. It's because the gut bacteria, when certain bacteria are absent, all of these different symptoms can be present. And many people report that they have a lot of brain fog, inability to concentrate, depression. When we tested the microbiome, we found that they actually had very little of the bacteria they needed for their memory and for their brain. So we can have any number of brain symptoms. They're all tied in with digestive symptoms. And especially memory, brain fog, depression, it's all tied in. So there's a lot of research that shows that when you actually take the good bacteria, and there's many of them, I'm going to go into which ones affect which part of the brain, which ones to take, they all help your body to then actually create a much better brain bacteria, brain pathology. You're going to go from being anxious to feeling like you're happy. It's such a big difference in terms of that. So which bacteria produce which neurotransmitter? So we found that many people are very low in either Lactobacillus or Bifidus, and there's a lot of species within that range. So, and so here you have that each of these bacteria, Lactobacillus produces acetylcholine, and then Escherichia and Bacillus and Saccharomyces produce norepinephrine. And if you don't have enough of the Escherichia and Enterococcus, sometimes the serotonin pathways are compromised. And then Bacillus and Serratia produce dopamine. So all that has been shown now that you need a diversity and variety of that. And we're going to talk about, because you need to get it not just from probiotics, but also from your food. So it's very important to know you can't just take a probiotic capsule and expect to get everything for your brain. You have to work with other lifestyle factors, with reducing your stress, because what happens is when you take these bacteria and you're very stressed, then it also cannot flourish in your body as you want it to be. So in order for the soil, the bacteria has to have a good soil, just like plants, to grow. We're going to talk about prebiotics and what type of food will actually support the bacteria. Another amino acid, it's very important, GABA, which acts as a neurotransmitter and calms the nervous system. Lactobacillus is a very important bacteria in GABA. So there again, the research has shown that when you change that, it really affects their brain chemistry. So getting enough lactobacillus is a key to reduce anxiety. So we know there's a really important connection between the brain and the gut. They're always talking to each other. So if your gut is inflamed, the brain is inflamed. You've seen a lot of the research about dementia, Alzheimer's, starts in the digestive system also, and in the fact that we're not eating the proper food and not enough of the good bacteria. So here are some mood food solutions. These are things that have to be done in conjunction actually with making sure, remember when you're gardening, you want to make sure you have the right fertilizer and the food for the soil. So we have found over the years when I've been working in the clinic is that it's very helpful to use the amino acid therapy when you're also eating the foods that nourish your microbiome. So again, taking these capsules, if you're devoid, if you don't have the right bacteria and the right prebiotics, will not support you at the level that you want unless you have nourished the soil first. So most of you know what leaky gut is, and I've done talks here in the past a year ago on permeability, so I will not say too much about it because there's not enough time. But I'm going to show you a movie now of the permeable gut and of the healthy gut. And so basically, what makes our gut permeable is actually when the lining of the gut allows, when it becomes permeable. It's like a sheath, if you can imagine it like a sieve, and it has a very thin net, and then it allows the molecules, instead of the sieve, keeping them out, it allows them to pass through into the bloodstream, the molecules that you don't want. And so Tom O'Brien talks a lot about gluten being a key factor in this. So because all gluten is now made, sprayed with glyphosate, and the wheat is so denatured in this country, he says that everyone that eats the wheat is going to have some form of permeability, that it's impacting the body tremendously. So wheat is one of the sources, but there's many other reasons why you could have permeability, and it will affect not only your brain and your digestive system. It affects your thyroid, Hashimoto's thyroiditis. Most of the time, autoimmune skin disorders have really healed well with people who have managed with the gut permeability protocols while they're working on the microbiome. Rheumatoid arthritis is a key. And also, if you get a lot of colds or you have ADD, ADHD, it's all connected. So again, gut permeability affects the whole body, just like the microbiome affects the skin profoundly, and the brain and the joints. So if you have a joint disorder, it's really important to look and see what's happening with your body and what's impacting you. So here's a movie of a healthy gut. So see how the large molecules bounce off, but they cannot get through the different molecules. So this could be fungi, bacteria, viruses, trying to get through the lining into the bloodstream. And so it's a very important, and then this is a leaky gut. You can see that the lining has been worn away by these, by the junctions over here. So you can see how much more goes into the bloodstream, and then we get an antigenic immune response. And so I would say 100% of the patients with Hashimoto's thyroiditis that we have seen at the clinic all have, every one of them tested very positive for a high leaky gut, including rheumatoid arthritis, lupus, so many times chronic disease actually starts with that gut permeability and then goes to the next stage. And what's interesting is that, again, the research shows that all of the amino acid pathways, that are natural pathways, are destroyed by glyphosate. Just to say, I know this is a complicated graph, but it just means that, unfortunately, in agriculture today, it's everywhere. We need to really focus on eating certified organic, growing our own food, being really conscious about that, because the problem with the sprayed food and everything with the glyphosate, even all the commercial food, is that it affects our brain so significantly, and that's why we cannot produce the microbiome. It's basically killing off the good bacteria, but it also makes our brains much more difficult to focus and creates inflammation, systemic inflammation. So as I've been doing this, it's been a very exciting time, because every single day there's some new information that comes out about the microbiome. And I know that's what everybody's been saying. I'm so excited about this talk. So what is the latest research about the microbiome? And so the Cleveland Clinic has recently, in 2017, announced in OncoTarget that the studies show that women mastectomy patients had very increased levels of staph, and the Actinomyces, very bad bacteria, they all had that bacteria in their breast tissue and also in the urine. And so it wasn't just what was so exciting for my European friends who were also talking about some of the research they're doing, to think about each organ of your body having its own microbiome. So the breast has its own, and the colon, of course, has its own microbiome, but so does your skin. And so in order to maintain the health of that, it's very important to eat 100% organic food, grow your own food as much as possible, and decrease the toxin exposure, because all toxin exposure is going to impact your microbiome. How you eat, the stress level, of course, the bad air, you could water, you could go on and on. But what they found is that the healthy tissue had a form of bacteria that the breast cancer patients did not have. So this is very important data that leads us to conclude that if it's very important to follow the aspects of testing your microbiome, working with it in many different ways to see what is it that you're cultivating. How are you cultivating your garden, right? Because what these patients were showing is weeds were growing all over the garden. They were uncontrolled. And I saw that in all the cancer research, that bacteria, virus, or fungi in the gut is definitely, in Germany, every cancer clinic I visited said, yes, this is absolutely the case, that all of the cancer patients had this biotic flora. And the immune system was fighting off, the bad bacteria all the time. And so this has now been proven, and it's showing up in all the studies that I've seen. Also, what they've shown is that both through mouse experiments and other experiments with highly diverse gut microbiomes, which the people have in the Aegean Sea and all the blue zones, they had a lot of diversity. And so when you grow a garden and you put really good soil and fertilizer, you get all this diversity, right, of microbes. And so this is the same with what we want to do, is that they found that in cancer therapies, and this was a recent study that microbiome influences response to immunotherapy, that actually the more gut microbes a person has, the more responsive they were to cancer therapy, which was really important. And diversity was the key, that when they had less diversity, that's really a factor. And then Journal of Cancer Biology shows that prebiotics were a key, and that to prevent cancer, you want to, again, and I'm going to go over which prebiotics to take and which probiotics help. But what was interesting is I just loved seeing this, that the probiotics would bind to toxins and food-based carcinogens. So if a person had enough good bacteria, then actually prevented colon cancer. So if you have strains of bacteria that really support your body, and you can get that from the food you eat every day, you don't have to take tons of pills, but when you know what you have in your gut and you have that, then actually the liver cancer treatment was really significantly impacted, and also all of the people that went through treatment, there was a big difference in terms of the outcome when they were working with that. In Crohn's disease, I've seen that with every patient. I worked with a lot of people in Crohn's, that when they start to change their nutrition plan dramatically, just like what you were saying, in terms of the nutrition plan usually is completely gluten-free, dairy-free, it's whole foods, and staying away from the grains. And within 1 year, this person reintroduced the good bacteria, and their Crohn's was in remission. I mean, it's amazing. But it depends in functional medicine. As you all know, it's not just one piece. It's many different aspects of it together. So MS, they were all showing that, amazingly enough, it's, again, different specific diversity of certain bacteria help people improve their MS status significantly. So this is another important key. Type 2 diabetes, gut bacteria is really important in fermenting fibers. And so there was a study about short-chain fatty acids affecting, of course, the glucose level, right, going down when you have enough fermentable fibers, and that has to do with the health of how your body is fermenting the fibers with your short-chain fatty acids. So when I do the digestive stool testing, we look at the level of all the short-chain fatty acids, including the butyrate, and compare that, comparing it also with the inflammation levels in the colon. Parkinson's, I've worked with some patients who had pretty severe motor deficits, who were, in a crisis state, but still in the early stages. And again, when you introduce a diversity of the microbes, the motor deficits significantly improved. So Parkinson's had some good results. I would say pesticide, it's interesting, pesticide exposure alters the microbiome, and this is thought to be one of the root causes of Parkinson's. One aspect of it is basically the particular pathophysiology has to do with that being a triggering factor also, among many other variables. So PCOS, polycystic ovarian studies, the women who did the best had the most gut bacteria diversity, meaning hundreds of different strains, sometimes billions and billions of different bacteria of each strain. And when they had less symptoms, they had more diversity, and the people with the worst symptoms had hardly any good bacteria in the gut. So I think what's happened, isn't it interesting? It's kind of almost like when we look at what we've done to the earth and to the farming, it's the same as it's happening in our own bodies. When I test people in my clinic, I'll be showing you a sample of a test. There's hardly any growth there sometimes of the very bacteria that we need for our brain and our bodies to function. It's not there. It's because when we eat the food we eat and we breathe the air and we do all that, the bacteria can't grow. So rheumatoid arthritis have a lot of Citrobacter, Enterobacter, Klebsiella as overgrowth. So on the test that I'll show you, there's a column which shows the bad bacteria growing over the weeds in the garden. They're overgrowing. And what do? We use natural antimicrobials usually in functional medicine. So we use ways that have been shown by independent assay to actually help with the overgrowth and bring it more into balance. And what's very interesting is that after a few days, when the mice, the lean, germ-free mice, received a transplant from conventional fat mice, even without eating any more food, they started to immediately gain the weight. And also the gut bugs from what they received affected their insulin production. So over and over again in the research, it shows that fat storage, how we process our nutrients. Without certain bacteria, we really can't absorb and process the nutrients in the proper way. That within a few days, the mice that had been given the same bad bacteria from the overweight, the other mice, became overweight. It was incredible, just within a couple of days. And so we know now that bacteria, certain species of microbes really impact your weight and how your body processes your blood sugar and your hormones. But the most important factor is the differences in the microbial communities really show dramatically with the brain research, and whether or not you will be dealing with a cognitive impairment has a lot to do with the health of the soil, so to speak, that we cultivate, how we eat, how we deal with our stress, and most importantly, these really life-giving bacteria. And so the brain fog is very much linked with having a deficiencies of a lot of good bacteria. And in the neuroscience news, what's interesting is that every patient with Alzheimer's and dementia had a different composition of bacteria. And so this particular study was on mice, but when we did stool samples from the patients with brain disorder, many of them had significant overgrowth and deficiency. The reason the bad bugs overgrew is because they have a deficiency in the ones that would keep them in check. So this is very important. And then the researchers also found, again, when they transferred the intestinal bacteria from mice that had the beta amyloid plaque in the brain, amazingly enough, again, there was a very strong correlation with decreased microbial richness. Just a few strains were found in the animals that that had the brain disorder. And for people too, when they were checking we checked people with dementia, and we just found that consistently there's an imbalance in the bacteria, and that was out of balance also. So that's very important. Allergies and asthma. How many of you are dealing with allergies or asthma? So quite a few. And so colds and flus and sore throats. There's a new article from Cell Host that says that, I'm going to talk about which bacteria would be beneficial, but it's more like really making sure that you're not eating the foods that you're allergic to, that you don't have permeability, that you're not eating the food that's very, sprayed, because that's where the allergies and asthma got significantly better when there was less inflammation. Because when you have dysbiotic flora, what I learned is that it's like a little Pac-Man that goes into every cell of your body. And it's not just that the dysbiosis is in the gut, it's that it sends inflammatory cytokines into every cell. So that's really important to see. And so there's a lot more studies that also, again, show cognitive disorders all are related to the microbiome, and as well as autism, ADD, and ADHD is very closely linked. Brain disorders, especially stroke and seizures, were related to people having a gut microbiome that was unhealthy, and also overgrowing with some very bad bacteria was more related to the cardiovascular system. So just like, we thought, oh, this is not connected here, it's not connected to the brain or to our hearts, right? Well, every piece of research I looked at says that our heart and whether we're going to have a stroke is connected to whether our garden is growing and flourishing with the right bacteria that support us. And so how many of you have heard of a fecal transplant? Because I want to tell you, I was so moved by this story, quite a few. I personally had a relative that had C. difficile. And this is a story of a patient in 2008 with Clostridium difficile. This is a woman who was near death, a young person, constant diarrhea. She had picked this up. She lost 60 pounds, and there was no hope for her, right? I mean, they had tried 10 antibiotics. Nothing had worked. She's having what's now called, this MDR, which is medication resistant. And she was getting more and more resistant to the medication they were giving her. So her husband's stool sample was mixed with saline, and it was just put in just like in a colonoscopy. And the C. diff infection disappeared in 48 hours and has not returned. And they did a genetic survey of the bacteria, because I know several people actually whose lives were saved by having, it's sort of like having a colonic, but a colonoscopy, they do the same thing, insert a tube, giving them the life-giving bacteria, and then these lives were saved with this really serious disease. So the genetics, before the transplant, this woman had no normal bacteria present. The Clostridium difficile just took over. It was terrible. I mean, imagine somebody who's dying, was totally healthy. And many people that I was talking to, say that now with the Superbox, you can touch a surface, anywhere in a hospital, in a clinic, which is what she did, and she contracted this, and she did not have the ability to fight it. One of the problems is we just like what you were saying earlier, Dr. Seifried, is we kept dousing her with antibiotics, and every antibiotic made her gut more permeable. So then she had a total leaky gut syndrome where all of the microbes went into the bloodstream, and the drugs just kept making it worse and worse. But you can see that when we had this, it's incredible that her husband, with his bacteria, just one time getting that bacteria infused, it took hold, and in 2 weeks after, normal microbes were flourishing in her body. I mean, that was just, and I've seen so many people who would basically have no more life with C. difficile, or they're ill for months and months with a fecal transplant. Their life is completely, they were able to receive their life back. So that's an example of how powerful it is. with the healthy microbes, and that they do colonize, even in this woman's body who had no normal bacteria. So one of the things you have to do when you colonize a microbe is you have to make sure you're doing it in the right amount, in the right way. But in this way, it was the appropriate one for her. So this is just a brief, fecal transplant. There's a lot of complexity to it. I'm not going to go into it. How many of you have heard about phage therapy? Just a few. It's interesting when I said fecal transplant, almost everyone raised their hand. I was so excited to see phage therapy because actually it's been pioneered in Eastern Europe in World War I. And it is an incredible breakthrough for immune health that hardly anybody talks about. The reason is because the phage therapy was so effective against bacteria that when the antibiotics became invented around that time, they immediately did away with the people who talked about the phages. So it's just having a recurrence now. So this is very political, phage therapy. I'm going to try to stay calm, but it was when I heard about this, and basically what it is viruses that are attacking specific bacteria. They're called bacteriophages, submicroscopic DNA and RNA. This is the structure of a bacteriophage. And it's now what I'm doing in my practice is I'm combining the bacteriophages with probiotics because they make a huge difference in colonizing. So lactobacillus, for example, with the phage therapy, grows much more steadily, stays much more stable. And so it's a major new development. And the phages attach to and selectively target harmful bacteria. So it's amazing that in World War I, people had terrible diseases, and they were using rectal phage therapy for them with really good results because it just attaches to and targets like a phage attacking a virus. That's what it looks like. And it's something that we don't hear about. It's effective in very small doses, functions in the large intestine, and all for dysbiosis or bad bacteria, small intestine, and it's effective within hours. When you take antibiotics, not that they're not necessary at certain times, but phage therapy before antibiotics were actually on the scene was very, very important for very strong viruses, bacteria. It was effective right away. So the difference between phage therapy and antibiotics is that in phage therapy, beneficial microbes flourish. So you can have a phage that's killing off a bad bacteria. It doesn't kill the rest of the body immune system, whereas with antibiotics, we know it wipes everything out. And so that's why if you've had antibiotics, I recommend you do this stool assessment and you look at what are your bacteria, good bacteria, dysbiotic, bad bacteria, because you can combine the phage therapy with the microbes, and it will really help to expand that. So there was a man, for example, also who had multiple drug resistant, and they actually matched the phage to his specific bacteria. So there's a lot of studies now that they will take the phages and connect them with whatever specific bacteria they have. And so I've mentioned about this. And so one of the things that I work with is really to help you, number one, to remove the bad bacteria. So after the talk, you can come up and see what this type of test looks like. But I just have a sample here of a test that is an example of the good bacteria, the intermediate, and the bad one, and how it looks and what is being measured. So we work with a number of natural methods to remove the bad bacteria and then remove the gluten and anti-inflammatory foods, repair the lining, and then re-inoculate. And the difference now is we're re-inoculating not just with probiotics, but with prebiotics, with phages, with a lot more than just the probiotics. So all of you know what probiotics are, so I'm not going to spend too much time, but they are very important in digestion, manufacturing of vitamins, making anti-tumor and anti-inflammatory. That's why the cancer patients all had very low levels. When you look at this test, this is the good bacteria, and they had virtually no good bacteria, all of the cancer in the study, and they had many, many bad bacteria. So there's a way that 6 months later we test the stool and we see what has happened in the microbiome. So I do this test, and I've done this for years with many physicians at the clinic, is look at the level of the good bacteria to help them maintain a pH that's appropriate, produce the short-chain fatty acids I was talking about, improve absorption of nutrients, and get all the vitamins and minerals. So the test shows you not only the actual bacteria, it also shows yeast overgrowth, and it cultures the yeast. And then what it does is it shows you which antimicrobials work for your particular situation. So I've just brought an example that for this particular example patient, there were 7 antimicrobials here, and it shows exactly in an independent assay which one will work. So I have some information here you can look at afterwards. So probiotics have to be strain-specific, species-specific, have a known benefit. And are they all created equal? No, because the ones that I work with are all independent assay tested, because you can go to the health food store, right, and just buy anything, and you don't know it's at the time of manufacture it contained 5 billion, but by the time you get it, it may hardly contain anything. It may not have very much in it. So you have to rotate species. I do a lot of different species, and it has to be customized, and you have to make sure that the independent assay evaluated. Otherwise, you might not have what's in the bottle. Here are the core species, and what I'll do is I will send people, I have a sign-up sheet there if you're interested in the test or you want to get some of the cores, so you don't have to write all this down. I can send you some of this by email. But the good thing is what I highly recommend is that, again, it's not just the probiotics. Have before every meal some kimchi, some sauerkraut. How many of you eat prebiotics, fermented vegetables here? Wow, a few people do. Great. So this is the soil, this is the fertilizer that gets the good bacteria. So it's very important. For example, Lactobacillus plantarum really helps with controlling pathogens, fights infections, reduces gut permeability. That's a specific strain. And it's found in sauerkraut and fermented veggies, so you don't need pills. You can just eat sauerkraut, rotate your prebiotics, and I'm going to give you more examples. Lactobacillus acidophilus, for most people, yogurt does not work because the stomach acid will not allow the bacteria to reach the intestine. So yogurt and other things you take by mouth, that's why the prebiotics are so important to cultivate. It doesn't often work. But anyway, this is the acidophilus. And then the brevis is for killer T cell activity. They've actually found in studies that brain growth hormone and cancer patients really do well with Lactobacillus brevis in high amounts. So again, you can test on these stool tests exactly how much you have, and there's different projects I'm involved in with different companies. So if you want to know more, I can talk to you after the talk about how you can find out what type of testing is best for you. The bifidolactase, again, actually takes care of, boosts immunity, and then the longum is really, really important. That's what you get from your mother, is the bifidus longum, and it's very important for free radicals, healthy cholesterol, and lowers intestinal pH, because in the intestines, we're looking for a slightly acidic milieu, environment. So the longum is really helpful, but if you were born in a certain way, C-section, you didn't get the longum at birth, and then you don't cultivate it with the foods and with what you're doing, then you're deficient in that, then it's affecting your whole system. So again, absorption of all your vitamins is impacted with this. There's a lot more benefits, and Saccharomyces boulardii, for example, really helps against C. diff infection, against E. coli. And I've had patients with Crohn's disease and ulcerative colitis who do so well with Saccharomyces boulardii. So again, this is a specific species that has made a big difference. They've even now have probiotics for the gum and teeth. If your saliva contains a certain type of bacteria that will actually help prevent cavities and help you with that. And so there's just different ones, again, if people are interested. But one thing that's very important, all the cultures that live to be 100, every one of them, they have, I was telling you about Nico from the Aegean Sea. Well, he was eating, every day he ate sauerkraut and different fermented products, even as children. So, and they get so few antibiotics or none that by the time, they just have this great rich garden that's growing not just in their intestines, but in every cell of their body. It's affected. So all of the cultures, we don't have enough cultures, right? We're a society where what we eat doesn't contain these live bacteria cultures. Here are the prebiotic foods: pistachios, asparagus, cultured yogurt, meaning coconut yogurt. I recommend coconut cult. How many of you have heard about coconut cult? C-U-L-T? Just one person here who I told about it. That's incredible. Country Sun Health Food Store, I'm going to do a commercial, carries coconut cult from Santa Cruz. This is a yogurt that has hundreds of billions of species that's in a yogurt. You don't have to swallow a pill. And it has colonized in my patients. I do these tests every 6 months with chronic disease. You can look at it. I measure all the bacteria, the mycology. We measure the inflammation level, whether they're absorbing the nutrients, their gut immunology. And one of the things that I found is the coconut cult really takes hold. Yay, right? It's something that has a diversity of species, and it's in a food. And so I really liked it, and I noticed no one knew about it. So I'm really glad that you can, and then eating lots of asparagus, kimchi, beet kvass, which is a beet juice, garlic, onions, and sauerkraut are some of the primary, prebiotic essentials. But one of the things that I found is so important is why guess when you can test. So every person, to do a functional digestive stool analysis, you will find out all of these markers about your body and identify if you're not absorbing your food. Are you absorbing? Do you have enough digestive enzymes? And it's non-invasive. So a lot of people say to me, what's the difference between a colonoscopy and this test, right? The comprehensive stool analysis. Both of them are important, but the colonoscopy is more like, it's invasive. It's looking for very serious disease, and it does not look at your bacteria. Colonoscopy doesn't tell you whether or not, what kind of microbes are in the gut, right? As a matter of fact, when you do a colonoscopy, it wipes all the microbes out. So the cleanse that they give you completely depletes your entire microbiome, and you have to rebuild it again. So I always say before a colonoscopy, do lots of, do a stool test and make sure you're really strong with the microbes, even if it wipes it out. But you want to have that in your body because it sort of like it leaves you complete, just like if you're on prescription meds, even over the counter, they do tend to wipe out the microbiome. So you get certain bacteria. And so cost effective, identifies the root cause, and it has lasting solutions. So I recommend once a year all of my clients and the doctors I work with do this test. And I have a sign-up sheet there where you can sign up your name and email, and we will ship you a test kit if you're interested in that. So again, they're very specific, identifying your inflammation markers. Crohn's patients saw that on this test years before Crohn's developed, that they were heading towards Crohn's disease, whatever inflammatory disease and all of that. You can also look at H. pylori and different kinds of parasites. And I do breath testing for SIBO. How many of you have heard about SIBO? Small intestinal bacterial overgrowth, a few people. So that's more, what I'm testing here with the gut test is the large intestine, but this SIBO is for the small intestine. And then, so we do a breath test for that, and then look at many other things with permeability testing. You can also do a urine test to see your level of gut permeability. So here's just an example of what it looks like. Here what a test looks like and how this, in the Klebsiella on the right, is a dysbiotic flora, and that would be inflammatory. And on the left, this patient has what NG means 0. So whenever you see an NG, so she has no lactobacillus, and she has an overgrowth of this bacteria. So it just gives you an example of what it looks like. The short-chain fatty acids, butyrate is very low. In the pink at 0.74, and you need at least much higher than that for colon cancer protection. So it will show you what your short-chain fatty acids are. And then also the other aspects. So I'm just going to talk about a few cases, and then we'll wrap up the evening. People have asked me, what type of patients I work with over the years. I mean, I've been really fortunate to work with many physicians referring people to me of Crohn's, ulcerative colitis. Recently, I've worked with both children and adults with really good results with inflammatory bowel disease. And what I'm working with is people who have been many steroids, many drugs, and this happens to be a woman with inflammatory bowel disease. And also, I'm just giving some information about them. But basically, what I always find is the root cause, integrative functional medicine, right? We're working not just with one aspect, but over time, what happens is that she actually went lower on the drug. So I work with the physician together, because many of these people I'm working with are women who want to have families. And when they came to me, they were in their 20s and said, I have flare-ups every day, I'm bleeding in my colon. I want to have a child and a family, but I've been told I have to be on drugs for the rest of my life. So what happened is, in her case, I used a lot of different things that would help calm the inflammation, but most importantly, she was eating a lot, just sort of the standard American diet. High sugar, high fat. So I'm just putting some of the things on here that we were using and that I was, but the most important was gluten, a diet that was a whole foods diet. For the first time in her life, she was away from the white flour, white sugar, getting off gluten. And she removed alcohol, she had been doing that. And then she also did the biofeedback, because a lot of ulcerative colitis is related to the vagus nerve. And so I have pioneered a system that if you go to the videos on my website, the talk I gave here, it was in January of 17, it's all about the vagus nerve and how you do train using biofeedback to help activate the vagus nerve. So we were doing a lot of work with that. And then probiotics and aloe vera. I mean, the anti-inflammatories, there's so many of them. This is just an example. She was very deficient in D3, but we were working with also very specific anti-inflammatories, turmeric, curcumin, a lot of different things to help her body and help her neurotransmitter. And you can see the high levels here of lysozyme, lactoferrin, and white blood cells, which are the conclusive marker of inflammatory bowel disease, ulcerative colitis. And she also had overgrowth of bad bacteria again. So what happened is with her is that basically 6 months after being on the nutrition plan and working with the food plan and all this, people went off the meds. All the clients that we have had have reduced their meds the first 6 months by 50%, and then after a year. And now, 3 years later, they have their babies. They just got married, had their children. They're traveling and showing me all the pictures of their children. So what's very important is to know that, no one protocol like aloe vera would not necessarily work for one patient better than the other, because it has to be integrated to their lifestyle. But what I do know is that in 3 months, this patient was off prednisone on one drug, and she had no bleeding episodes or cramping. Before, every day she had bleeding and a flare-up. And she said 100% improvement if she stays on the gluten-free and on the whole foods diet. And then, it's just been, it's amazing. Here, this is before, and 6 months later, she was off of all meds, symptom-free, no more flare-ups, feeling great. And so a lot of I'm so happy to report that many of the children, I've been working with 9-year-olds, pretty severe ulcerative colitis, where the scope shows when they do regular colonoscopies and all the tests that they do, that there's a significant change now a year later. And they're using the latest we can use, the probiotics, but we also use all the foods, the prebiotic, and also the latest with the vagus nerve and helping them in that way too. So people's acne cleared up by 50%, a lot of things that was very helpful. Glutamine, for some people, I'm very cautious with glutamine. I work mainly with the doctors around that, but there's many different things. So food as medicine, I want to leave you with this, that the number one aspect is every person that I've been working with over 20 years has said, that you cannot take it in pill form. You need to have food as medicine as the foundation. get off the pesticide, herbicide sprayed Roundup, really healthy food. And I have a sign-up sheet there, so for anyone that calls me at my business card is also over there. If you call that number within 24 hours, I can then talk with you about getting this test. You can look at it today and see what it looks like, and I'm giving you a significant reduction in the cost of the test, and then we meet and customize a protocol for you. So, but I really feel the most important thing is to really look at right now, the microbiome is depleted so rapidly in our culture. And so I just want to leave you with this again, that to really cultivate your own soil by having really microbial-rich foods and do the testing, right? Guess when you can test, if you can. And really take care of your stress levels and to work on detox on a regular basis too, so that you have a flourishing microbe, right, with a lot of healthy diversity. And I'm happy to, when you sign your name there, just put next to your name, check it off if you want to do a gut test. I'll put it over here. You can ask me any questions. So if people you want to ask a few questions now, if there's anything?
Sure.
Okay.
Yeah. Thank you.
Okay.
So. I saw this hand go up here first, so.
I just wanted to ask what your opinion of kombucha is.
That's a very good question. I actually have a mixed opinion because it's so high in sugar. What happens is, again, each individual is so different. That's why I do this customized testing, because if you have yeast overgrowth already, or if you have some kind of microbial imbalance that is fed by sugar, then kombucha sometimes is not the best in terms of a source of probiotics for certain people. And it could be great for others. Again, it's very individual. Yeah.
I'm curious about probiotics. It seems years ago you could only get them in the refrigerated section at the store, and now there seems to be a trend where they come to you not refrigerated. They tell you they're just as good as the ones in refrigerated section, but it seems to me maybe not.
Actually, that's a good question. The strains in the refrigerator are more viable all across. I mean, it's really, there are some that are non-refrigerated that I work with, like one type of strain I recommend, but the ones that I always recommend is refrigerated kind. It's more viable, definitely, yeah.
Okay, so I have one question here, and then I think we need to wrap up after this one. So you'll be around for a few minutes to take questions individually. So one more here.
Okay.
What about people with a leaky blood-brain barrier? Would you treat them the same way?
With
a leaky blood-brain barrier?
Yeah, we've worked with a lot of people with that. I mean, primarily it starts with permeability, as I was mentioning. So then the gut-brain barrier, you can talk with me more about that. But yes, we have worked with a lot of people to heal the leaky gut, to heal the leaky brain. You have to also investigate what caused the leaky gut and work with that. Yeah.
Okay, very good. Christine Rosche, thank you once again.
Yeah, okay.
Good.